name is Frank D'Alessandro. I am a primary care physician practicing in Lincoln and East Greenwich, Rhode Island. I want to thank the chair and the committee for the opportunity to give my support on the Primary Care Preservation Act introduced by Representative Marie Hopkins. I am a local Rhode Islander born in Providence, and I have practiced primary care medicine for over 3 decades, both in private practice and working for a corporate entity. Although I considered retiring due to the frustrations for working for a corporate medical practice, I decided to reopen a private primary care practice in East Greenwich, Rhode Island in June 2024, just last year, with 2 other physicians forming MDRI. We have since added multiple providers and opened satellite practices in both Lincoln and Johnston, Rhode Island. By the end of this year, we will likely employ over 20 providers servicing up to 30,000 patients. Unfortunately, we are starting to experience financial strains encountered by virtually every medical practice in Rhode Island. The abrupt closure of Anchor Medical was not only devastating to the state, but also concerning to our organization, as we feel we will likely be in a similar financial crisis within 1 year or sooner. The proposed bill allows for primary care providers to charge a $10 monthly fee, or $120 annually, to those patients with private insurance. This would have a significant and immediate impact on stabilizing the finances of not only our practice organization, but other practices, both large and small, in the state. This extra revenue would allow those practices to immediately invest in their organization by hiring additional staff and providers to accommodate the need for primary care services in the state. And this will result in practices competing for patients and thus begin to solve the problem of primary care access. At present, all insurances prohibit charging patients any additional fees, as this violates the provider contract the insurance companies require providers to sign. Therefore, the proposed legislation would allow medical providers the option to charge this primary care contribution fee of $10 monthly. If this bill were enacted a year ago, it is very likely Anchor Medical would not have closed so abruptly. This assertion is supported by Dr. Michael Fine, also a supporter of this bill, who is the former Rhode Island Director of Health. And we just heard the testimony of Dr. Baraha was compelling that this would have also helped him. Without this bill, the immediate financial stabilization that it would provide to practices, more practices closures are likely and will result in flooding hospitals with patients that they can't handle. I believe this bill is a win for all, as it provides an immediate, common sense, practical solution that will prevent primary care practice closures and reducing the strains on the healthcare system. I appreciate the opportunity to give my opinion, and thank you very much.